everyone, today we are going to talk about penicillin, the great turning point of human mortality. Penicillin is one of the most important antibiotic agents and is used to treat numerous bacterial infections. Occurring in a variety of forms, penicillin kills sensitive bacteria during their growth stage. It is one of a series of beta-lactam antibiotics, all possessing a 4-ring beta-lactam structure forced with a 5-membered cytosine ring. They are produced naturally by penicillin moles or prepared synthetically. Penicillin inhibits activity of enzymes that are needed for the cross-link of peptidoglycans in bacterial cell walls, which is a final step in cell wall biosynthesis. It does this by binding to penicillin-binding proteins with a beta-lactam ring, a structure found on penicillin molecules. This causes the cell wall to weaken due to fewer cross-link and means water uncontrollably flows into the cell because it cannot maintain the correct osmotic gradient. This results in cell lysis and death.
So how does the penicillin is used to treat the medical condition? Penicillin is used to treat a wide variety of bacterial infections. It prevents infection of the heart, like bacterial endocarditis, in patients with certain heart disease who are having surgery. It is also known as a natural penicillin antibiotic to stop the growth of bacteria. The clinical impact of penicillin was large and immediate. By ushering in the widespread clinical use of antibiotics, penicillin was responsible for enabling the control of many infectious diseases that had previously burdened with subsequent impact.
Now we are going to look at a very relevant clinical trial. It was done by Edward Hook, which is about the treatment of early syphilis. It is a prospective, cohort, multicenter, and randomized clinical trial to investigate the treatment for sexually transmitted disease. This trial was conducted with a total of 517 participants in between the age of 18 to 55. 255 participants were randomly selected to receive 4 500 mg of azithromycin tablets orally, and the rest of 262 participants received 1.2 million units of bendazine penicillin through injections. The clinical examination is at the 7, 14, 30 days, 3 and 6 months. The results were ideally that penicillin was more efficient. This trial showed that at every 2 grams of azithromycin has the equivalent efficacy of 1 gram of penicillin for the treatment of early syphilis. Now let's compare penicillin with other antibiotics and the clinical practice use. A clinical trial of comparing penicillin and cefuroximide to analyze the treatment for penicillin susceptible Staphylococcus aureus in relation to 30-day mortality. The method was by using a retrospective case series review of patients with this bacterium in 6 hospitals, and it was isolated from the blood culture. The result has shown that cefuroximide was associated with an increased risk of 30-day mortality compared with penicillin. The matched case control study showed that treating penicillin susceptible SAB with cefuroximide led to a poor short-term outcome compared with penicillin, a higher 30-day mortality. Why is that? The possible reason would be the changes in penicillin binding proteins. Penicillin and cefuroximide have different affinities of the 2 beta-lactams. Another reason is the differences in the pharmacokinetic activity of different antimicrobials. Penicillin has a smaller risk of falling short of the optimal pharmacokinetic parameter. The treatment with cefuroximide compared with penicillin has a significantly higher mortality. At last, the discovery of penicillin and the development of the supporting technologies in microbiology and chemical engineering leading to its commercial-scale production represent it as the medicine with the greatest impact on the therapeutic outcomes. Thank you for watching.